Hi, good morning, good afternoon, and good evening. I have been assigned to make a presentation on malaria elimination. Are we assessing the needs? Malaria elimination has been targeted for elimination by 2030, and that is why there is a necessity to understand what is the basic problem for malaria elimination. If you look for global malaria problem, you see the red color which has been endemic for malaria from decades. And then the malaria incidence, which has been stratified from different 0 to even 250 cases per thousand population. So the highest are the black ones, and then slowly, gradually declining with different color marks. The WHO also has estimated and given a warning that if we go by this trend, a normal trend which we have been following since 2000, this has been, we will be achieving like this. But if we intensify malaria elimination strategy, will go like this. But if we fail to do that, maybe any regions, then we will go by the red line. So there is a threat of going for the worst scenario when we may encounter the increase in malaria cases. And to combat that, there has been various guidelines, issues, and recently there was a global technical strategy and then a global vector control response, where basically the whole setup is evolving, that political will is the most important thing. Then the strategic information should be made available. Better guidance is always required, and then coordinated response. In silos, it will be very, very difficult to go and achieve the output. So these are the four main pillars. When we are talking of malaria elimination, after having said about the world scenario and the warning signals or the prospects, the way we go or the way we intensify or the way we show our reluctance, let us discuss a few things about India, which is one of the high endemic districts out of 11 in high burden districts identified by WHO. See, there has been a lot of efforts towards malaria elimination. Initially, it was control. It was turned out to be an eradication program. Then there was some challenges and there were relapses. Malaria cases increased, and then revised policies were formulated. There were support from external donor agencies, and then finally malaria elimination concept has been launched in 2016, and the strategic plan has been launched in 2017, along with the integrated vector manual, which is a very, very essential component of the response mechanism in controlling or eliminating disease. These were the four guidelines which were released, like malaria elimination framework, then operational manual, malaria elimination strategic plan, and integrated vector manual. Now, if you see the epidemiological situation, malaria has been on decline, and that is documented. If you look from 1995, see the red colors with high annual parasite incidence. It has gone down further in 2015. It has gone down further in 2000, you can say 17, very, very limited area where it has been. So the case detection system, which was started in India in 1961, since that the regular data of the system is available. And if you see till 2017, the analysis was made. The PF is little on higher side, increasing percentage, but the overall cases are declining. But the increase in PF has always been a concern. That PVPF, which used to be 50-50%, now it is slightly up in the PF proportion rate. So these are the different phases which I just told that whatever has been changes in the strategy, and then it has been taken up. If you see the latest figure, 71% decline in malaria in 2019 versus 2015. There has been 80% decline in malaria deaths also. Malaria situation therefore looks like it has improved. Actual impact, because COVID, there was a decline in surveillance. So actual impact may be visible in after 2 years or 3 years. Now, what has been done for the country so far as malaria elimination is concerned? Malaria elimination purposes, the country has been divided into three categories: high, moderate, endemic areas. So there has been number of provinces which are in category 1, that is 15, in category 2, the moderate one, that is the 11 provinces, and then category 3, there are 10, the red color marked high endemic, high burden states. These are the name of the states, which if someone is interested, he can just find it out. Now, what are the basic strategy remains the same. Only thing is that parasite detection, immediate early detection, complete treatment, new diagnostic tool like rapid diagnostic tests and combination therapy for treatment, ACT combination therapy. And then we have to be prepared for any outbreak or epidemic and then go for rapid response. This is very, very important. I'll come back to this rapid response. Integrated vector management as a response, either by indoor residual spray with insecticide in selected high-risk areas or long-lasting insecticidal nets. And then larval source management is very, very important. But to implement this, the supportive intervention like human resource development is another challenge area, and then behavior change communication, social mobilization, and then monitoring and evaluation is very, very important. Without these, strategy implementation will be very, very difficult. Now, having said that, the three categories, what are the strategy to be followed in these categories? So the highest burden states, we have to do our measures, all the measures which are recommended, like long-lasting insecticidal nets, source reduction, indoor residual spray, larviciding, biological control, environmental management, insecticide resistance monitoring, entomological surveillance, everything we have to do as a response to contain or control or eliminate the disease. Going back to the second group of the states where little moderate infection is prevailing, we can go for 2 rounds of indoor residual spray, depending on the LLIN distribution and feasibility, because some of the very, very humid climate area, LLIN or bed net uses are not preferred. However, the source reduction and larval source management will continue, biological control, minor engineering. They should be prepared for any focal spray and outbreak situation, and then advocacy and entomological. These two things will continue in all the area. Same is the case with the low burden states or green color, if you are seeing, but the only thing that insecticidal residual spray operations, that is a regular course of action, is excluded, and all other things will remain same, so that the area is contained on this. These three parameters are very, very important because this will require a lot of human resource. So what are the perception towards elimination in the basic general comment on that? That everybody knows that vector-borne diseases are of major public health concern. They do affect our social development. They are transmitted by some of the insects. So most of the people, they know it. What is not known in detail is how they are associated. But we know that they are associated. There are environmental factors, ecological variations. There are deficiency in water supply, so water storage practices. Rapid urbanization has created a lot of havoc, like by aggregation of the labor force, population increase. Similarly, industrialization, colonization, climate and climatic changes have definitely impact. There are many, many articles on that, vector resistance to insecticide and parasite resistance to drug. What is to be done to combat this, we must focus from bigger unit like states and districts. We can narrow down the area, and that can be done only by stratification. And community has to be mobilized. So community ownership is to be generated. Mindset is to be changed, that it is not only health department responsibility. Health department becomes the victim department when something happens. But it is not the shirking the responsibility, but everybody should come together. So the people who are creating like construction departments, irrigation departments, or education department have the responsibility to educate the children. So they must cooperate and contribute to the best of their capability. Human resource is the biggest challenge, that without human resource you cannot perform any work. And that, if a better example of some of the countries can be highlighted, that will be good for malaria elimination achievement by most of the countries. So this is the main issues. And then real burden. But the moment we talk for elimination, everybody is happy that we are doing a lot of work. But when it comes for certification, these questions are asked, that what is the real burden of vector-borne diseases? Can you do a reassessment? It is always better to go for digital platforms so that it can be real-time monitoring can be done. This is just out-of-box thinking, but this will definitely be required if some countries apply for the certification of elimination. So this is very, very important issue. Then the another issue, important issue, is that who will do it, who can help in this, who can come at our, whom we are needing. So vector control, public health entomologist and biologist will be required to do vector biodynamics, transmission studies, insecticide resistance, and designing the vector control strategy, because they are the expert for this. Similarly, for parasite elimination, case management, and diagnostic, the public health specialist or medical experts will be required. But real-time data monitoring, data management, compilation, display, giving a feedback, we do require digital experts. But these days, this is very, very important to take the help of the technology. What we have learned during the COVID is very, very important, because we know that there has been 32% decline in surveillance. But we know that the good thing is testing and tracking, 100% digital platform have been used from all the public and private services, which we have been telling that private people, they are not reporting malaria cases in most of the countries. Supplies were also channelized, so we also cannot say that even short expiry things cannot be utilized. The only thing it is to be really monitored. So this we have learned from testing and tracking procedures during COVID-19. 100% real-time reporting was even for the vaccination, first and second dose. The moment the person is vaccinated, it is entered in the computer and it is displayed countrywide, or maybe the world also can see to it. We have also formulated the strategy for containment zones, where strict locking, nobody can go, and then you can go do whatever work you want to do for prevention. That also can be done, which we have been doing earlier in malaria eradication phase, containment zones. So these were the last slide, which I have summarized the entire things, that what is malaria elimination task ahead, and then what are the basic challenges in summary. So the adoption of global technical strategy from 16 to 30 point wise is very, very important. If we do not do point wise strategy adoption, it will be little difficult by jumping. And so no knee-jerk phenomena will work in this case. We have to understand and we have to do the assessment, and for that it was recommended that feasibility study based on technical, basically this is an assessment of the program, technical skills, existing gaps, challenges, operational and financial resource, what is the gap, what is the plan, what is the challenge for malaria elimination. Upscaling and upgradation of monitoring system, that's what I was discussing about the benefit of the real challenge. Real-time monitoring, if it is not done, we will not be able to know the actual disease burden. Sub-national elimination malaria strategy is to be immediately followed and circulated and popularized, so that people in the far-flung areas, they know what to do for low endemic areas, real-time on reporting, how to do case-based response, and what will be the foci-based response. Similarly, how to identify asymptomatic malaria, because in rapid diagnostic test kits, it is very, very difficult to go for asymptomatic malaria, which we can do only by the gold standard methods of microscopy. Then target approach under IVM is most crucial parameter. IVM per se on paper will not work unless it is more popularized and given certain flexibility at the local level. And then cross-border surveillance is always a threat in most of the countries, so this is to be mentioned. These are the basic challenges that health system which is functioning in different area has a varying capacity. So wherever it is not performing well or there is a poor capacity, it needs to be checked, it needs to be upgraded, it needs to be monitored, it needs to be uplifted. Otherwise, malaria elimination will be a challenge. Then the main challenge is the hard to reach areas, conflict affected areas, tribal area. Still there are problems because for no facilities to live in, the service providers, they do not want to stay there. So they come from far-flung area, and that becomes a challenge in different high burden states, especially. Even in low burden states, there are chances that 1 or 2 cases may appear indigenous, and then there will be a flare-up. Then the spread of insecticide or drug resistance, which is to be monitored on regular basis, which do require specialist people to do that, and which is very, very difficult. It cannot be immediately done in 1 day or 2 days. So regular monitoring will be required. The whole system's capacity and capability, including by virtue of skilled human resource for surveillance, for real-time reporting, has to be uplifted, upgraded, strengthened. And for that, regular trainings, regular social mobilization not in terms of the community, but social mobilization or advocacy for the policymakers, for the bureaucrats, for the finance people will be required, so that the budget is also not cut if the cases are less. So budget should not be linked with the number of cases. Then large international borders, which offers continuous threat of disease, migration of the people from this to that and that to this. So this will be very, very important to migrate. And so this is what I just wanted to tell about the challenges. Thank you very much. We have to do together to achieve the malaria elimination. Thank you very much.